One thing we've learned with the studies that have been done with immune therapy is that there are side effects, but they're very different, and they tend to be very different than side effects with chemotherapy. Overall, there seem to be less side effects with immune therapy, and the side effects that do occur usually tend to be not as difficult for patients to tolerate as with chemotherapy. And I have many patients who've received immune therapy that have no side effects. They feel great with the drug. But there can be side effects, and mainly the side effects that we see with immune therapy are those that are related to the immune system, which makes sense because you're activating the immune system to fight the cancer, and so it can also attack normal organs and tissues and cells. And so what we see is autoimmune problems, and that could be very varied. So you can see issues with the skin because of autoimmune issues in the skin. You can see something called pneumonitis, which is inflammation of the lungs. It can affect the liver. It can affect the GI tract, so you can get something called colitis, which is inflammation of the colon or the intestines. So really anything. I mean, I can keep listing. It's possible to get inflammation or irritation of really any organ in the body with immune therapy. It, again, tends to overall be well tolerated, though. These things happen, but they don't tend to be too severe, and when they are, steroids can really typically shut off the immune response to those organs and can make people feel a lot better and get better. So if any side effects do occur, I always think when someone's on immune therapy, could this be an autoimmune side effect, and do I need to start steroids to make the symptoms improve? So I think that's something to really keep in mind. And actually, one I didn't mention is endocrine problems. So thyroid problems or adrenal or pituitary, those things can all be affected by immunotherapy, and it's something to always keep in mind. If any patient's having a symptom, could this be an immunotherapy autoimmune issue, whether it's thyroid or lungs, whatever the organ involved is.